Welcome back. Every 40 seconds, someone in the United States has a stroke. In this segment, sponsored by Primary Care Plus, we are joined by Dr. Stephanie Sarrat to tell us about an easy memory tool that can help you quickly spot the symptoms. Thank you so much for joining us today.
Good morning, and thank you for having me.
So you were talking about strokes. I've actually had several family members that have experienced having a stroke. It can be really scary. If you want to first just kind of clarify exactly what is a stroke and then how does it affect the body?
Sure. So a stroke is a brain injury, and when it happens, blood flow to the brain is occluded either by a clot or a rupture in a blood vessel can occur. So when the brain cells are not oxygenated by receiving blood, they malfunction, and death of brain tissue can occur. It can result in permanent disability for the patient and even death.
Right. So it's really important to kind of spot those symptoms early. The earlier the better, right?
Time matters in a stroke. You know, the best treatments are only available for people who get to the hospital quickly.
Okay, and so earlier we just mentioned about an easy memory tool that you can kind of rely on to help you spot those symptoms. Tell me about that.
Yes, today we're going to learn the FAST acronym.
Okay.
So this will help with symptoms of stroke and also what to do if you spot the symptoms of stroke. So we'll start with F.
Okay.
F is for facial asymmetry. That's a facial droop. So ask the patient to smile. See if one corner of the mouth curls down. That would be a facial droop.
Okay.
A is for arm. We're going to look for arm or also leg weakness, but ask the patient to raise both arms, see if one arm drops. S would be slurred speech. Ask the patient to repeat a simple sentence, see if their speech is slurred or clear. And T is for time. Time matters. Time to call 911 if there are symptoms of a stroke.
Okay, I really like that, and I like that it's fast because you also have to act fast, right?
Yes.
Yeah. So what should you do if you're not sure whether someone is having a stroke or not? You know, what is some advice that you have for that?
The best thing to do if you're not sure is to go ahead and call 911 because, as I said, time matters with a stroke. And there are some treatments that can reduce permanent disability and reduce a patient's risk of death. So you need to get to the hospital fast. You should not try to drive the patient, and you certainly should not be trying to drive yourself. Go ahead and call 911 and let trained professionals evaluate you and make a decision.
Okay, really good advice there. Are there any ways possible to prevent a stroke? As we're kind of talking about this and acting fast, is there any advice as far as prevention? Absolutely.
Many strokes are preventable. Lifestyle matters. So things like a healthy diet and exercise can help. Also limit your alcohol consumption and don't smoke.
Okay.
If you have chronic conditions, it's important to work with your doctor to control those. Things like high blood pressure and diabetes and high cholesterol. Good management of those problems can reduce your risk of stroke.
Okay, so how can people find out more information about Primary Care Plus and then also the clinics that you have, right?
So Primary Care Plus is a local primary care company. We're based in Louisiana,
okay.
And we operate primary care clinics in communities around the state. And our clinics are focused on quality rather than quantity. Our doctors spend time with patients and establish personalized treatment plans and try to form meaningful relationships to improve a patient's health. You can find us on Facebook or at primarycareplus.com.
Well, thank you so much for joining us today. Really good information and advice. I love that FAST acronym that you kind of showed us to go ahead and respond fast when you are seeing those symptoms from somebody having a stroke.
Thank you. Thank you for having me.
Of course.